Groote Schuur Hospital is the first public health institution in South Africa to perform robotic-assisted surgery with a new state-of-the-art machine. The hospital is now one of 8 hospitals in South Africa which will be performing such surgeries. For more on this, I'm joined by Dr. Samkele Salukazana, who is a robotics coordinator at the Groote Schuur Hospital. Dr. Samkele, a very good afternoon to you. And once again, Groote Schuur Hospital doing things that others before, really few before, have managed to do. Tell us about this robotic surgery. What exactly is it and how does this mechanism work?
Thanks a lot. Good afternoon. Yeah, so as you stated, we actually the first public sector in Africa actually to acquire a robot. So how it works basically, it is essentially a form of minimal invasive surgery, which is basically using keyhole surgery to perform major operations, which could be done in different units or disciplines, which will include urology, gynecology, colorectal, and other disciplines. So essentially, it's a similar concept to laparoscopy, where basically, as I said earlier, keyhole surgery. You put a few instruments, depending on the site where you're operating, and you've got the different components of the robot. One is the surgeon's console, and the second one is the patient cart, and the other one is the vision cart. So the surgeon's console is essentially where the surgeon operates and does most of the maneuvers, which are carried on by the patient cart, which essentially has arms, which actually holds the instruments in the abdomen, which is depending on the operation you're doing. And then you get to be in control of these arms when on the surgeon's console, which really brings about significant improvement in how we do things and how we operate, because you've got a much better view when you're sitting on the console, 3D dimensions. You've got very better, like magnified vision. You can clearly see, even tiny sort of vessels or nerves that you would like to spare in some other operations, which includes doing a radical prostate. And then you still have an assistant who stand by the patient and the patient cart, and the nursing sister, the scrub nurse, who also gets, involved with the procedure. And that's really what it's about. It's essentially you're doing laparoscopic surgery, but the actual term is robotic-assisted laparoscopic surgery. Laparoscopic surgery, the conventional way, a lot of limitations because you only have 2-dimensional view and very limited motion and range of motion, essentially, of the instruments. And that's why the state-of-the-art machine really does wonders. It goes through corners, and with the better magnification and visualization, then one can do more safe surgery and reduce complications.
I mean, as you say, it does wonders, and I'm sure the price tag on that as well will cost wonders. How affordable is this technology for the average South African?
Yeah, no, thanks a lot for that question. Getting the actual machine is quite pricey. It's a bit expensive, but I think the Minister of Health did mention the figures yesterday. So the good thing about this robot being in the state practice is actually to afford equal opportunities, to the patients in the rest of the country to get access to a robot in state, because they will actually not be paying for it, as opposed to going into a private sector where you'll be charged. I think the medical aid is actually paying most of the payments now, but there could be a co-payment in private. But in state, everyone has got equal access, to the robot. Obviously, if you are, a patient that actually does work and does earn an income, you'll probably pay a bit of a portion, as all patients actually do pay for some operations in the state. But for an ordinary patient who doesn't work, who's got no income, who actually gets the best surgery done, by the best equipment in the world without paying anything for it.
Usually when a surgery is being conducted, there'll be a number of surgeons in the operating room. What does this mean about job security for surgeons then? Because my assumption is that you don't need as many people to be attending to this.
Yeah, thanks for that question. So, when you're doing an operation, there's minimal numbers of surgeons that you need when you're doing the procedure. You need the primary surgeon, you need an assistant, and you need a scrub nurse. So essentially, when you're doing a robotic surgery, you still have the same number of people that are needed in an operation, and which is the surgeon who operates the console, and the assistant who sits by the patient and does a few maneuvers around the patient, changing sort of instruments, and then the scrub nurse obviously does a lot around during the surgery as well. So essentially, you haven't taken out anyone in the field. The only thing that you've done is that you've made everyone's work easier, because if you're doing laparoscopy, the assistant has to actually hold the camera and keep on moving in directions to try and target the area that you're looking at. But with the robot and playing with the console, as you play around with the instruments, the camera actually follows you because it senses the movements you're doing, with your fingers with the instruments. And the other thing you need to really remember that the robot does nothing to the procedure. It just makes your life a bit easier.
Dr. Samkele Salukazana, thank you very much for your time. Certainly a worthwhile innovation and advancement in healthcare, and especially it being in a public institution. Thank you very much for your time this afternoon.